Welcome to episode 5 of The Spill on Women's Health Plus. Thank you so much for joining us today. Part 2 of episode 5 of The Spill focuses on miscarriages, but from the clinical and psychological perspective. We'll be talking to a doctor and a guidance counselor about the experience of miscarriages. Thank you so much for joining us, and we are sponsored by Nature's Discount Dominica, who we thank so much for their support. Second half of episode 5 of The Spill, where we're talking about miscarriages. I have joining me Dr. McIntyre, who is a medical doctor, and Mrs. Yankee, who is a guidance counselor with training in grief and loss management. So we're going to be dealing with the clinical and the psychological side of miscarriages. And we've already, in the first half, spoken to somebody who went through a miscarriage. Now we're going to get to the why. So Dr. McIntyre, I will start with you and asking you from the medical perspective, what reasons could cause a woman to miscarry a baby? What are the reasons behind miscarriages? We often ask why.
Why?
Why?
There are many reasons. First of all, one of the main reasons you can think of it would be a genetic disorder, chromosomal disorder. That the body will actually naturally terminate the pregnancy because it cannot really sustain that pregnancy. It wouldn't make sense. So that is one of the main causes that you're experiencing during, let's say, the first trimester, or on the 12 weeks of pregnancy. You also have things like hypothyroidism, thyroid disorders. You have diabetes, can be one. Also underlying issues, genetic issues that the person may have. Alcohol use, tobacco use, drugs, those things can do that. Even having high blood pressure can cause those things. So there are many reasons. There are many reasons that can actually cause that. So it depends on what the person is, also the age of the person. Advanced maternal age is something that we see a lot, especially in our third world country. Yes, we see that a lot.
Tell us what's advanced maternal age, because we hear advanced, some of us might think we're advanced and we are. So tell us.
No, don't get me wrong. Don't get me wrong.
Age.
In the medical world, advanced maternal age is from 35 onwards. Okay? But I'm not saying you're advanced. Don't get me wrong.
I just wanted for our audience to know, what age are we talking about? 35 and up?
35,
okay.
Yes. Okay. Because at that age, your body naturally starts to is not as young as you could. The organs are not as equipped. Also, from time you're born, you have eggs that grows with you. So the health of those eggs also can add to that. So you actually have increased chromosomal defects at that time, at that age. So you have probably Down syndrome probably happening much more, So it's those things. So that's advanced maternal age.
Okay.
But I think we kind of Dominica.
Okay. A lot of times when a woman undergoes a miscarriage, she might ask why, did that happen to her, and what could she have done to prevent it? I know there are a lot of feelings of that. So medically, could a woman who is maybe some of the things you mentioned, diabetic or has hypothyroidism, are there things that can be done to reduce that risk of having a miscarriage?
Well, in the event that you do have a miscarriage for the very first time, my advice is that you seek clinical care from your primary physician. will then probably advise you to probably seek from a gynecological or obstetric, So it depends on what caused it. So you have to be investigated because you do not know the first time what caused it. Cervix is too short or the cervix was weakened by some form of trauma. So therefore, anytime she's pregnant and if she passes the first trimester, the cervix cannot hold that pregnancy. So therefore, you have a miscarriage happening. So medically, we go in and we do what we call a cerclage. We put in a stitch to really hold the uterus together. Okay? Well, the cervix is in uterus. Yes. But medically, hypothyroidism, you have to see the doctors, ENT doctors, to periodically check yourself. If you're on medication, to also be titrated to be on the right medication to control that. Diabetes, control your diabetes. Healthy lifestyle choices, eating right, not smoking, all those things, yes. Right sleep patterns, those things can help. But medically, kind of hard to say I'm just going to stop a miscarriage. You cannot really per se stop a miscarriage. What you can do is intervene and hope that you're successful because none of these measures are actually 100%.
Right. So there's still a chance.
There's still a chance.
Right. So a lot of uncertainty where that's concerned. And what about women who have had multiple miscarriages? Now, as a physician, you've seen someone who has miscarried 3, 4, 5 times. What do you say to that person? What kind of advice would somebody who has undergone multiple miscarriages get from the medical world?
Well, I will hold my advice more to the clinical part of things, not the psychological part of things. Okay? Well, it's to be investigated properly, to find out what exactly is going on. Why is it going on?
Okay.
And then from investigating, we can then take a better approach and see how we can manage that. Okay, as I said, the cervical incompetence will do this stage. If you have repeated or recurrent miscarriages, underlying issues, probably antiphospholipid syndrome, which can be, you can give probably low-dose heparin throughout the pregnancy to help with that. Therefore, it depends on what is causing. So investigation first, and then we can take the necessary steps to help you.
And I think what you're saying is so important because I know of people who have had multiple miscarriages and they have not gone through that process of investigating the reason why. Like I've heard things like, oh, I just have a male and, that kind of thing without the investigation that you're talking about as to why has this occurred multiple times.
Yes. So I think that's why the show is necessary.
Yes.
To shed some light and give people a certain insight as to you're not alone. And it's not male, as we so like to put it, that you have.
We like to talk about male.
Yes.
I mean, in the local palace, I mean, something happens like that and it's a bad luck but the medical investigation is important.
It is important, yes.
Okay, definitely. So, Mrs. Yankee, I'm going to shift across to you a bit because we want to talk about that psychological aspect. Of course, having a miscarriage is something that might be hard to deal with psychologically. I want you to tell me from your experience, dealing with people and dealing with grief and loss, how does having a miscarriage affect a woman psychologically? What have you observed or seen?
Okay. Well, before I go into the different psychological effects, we need to note that a miscarriage is a traumatic event. And I think a lot of times persons don't realize that it is traumatic. And based on it being a traumatic event, that leads to the different psychological effects. So you have experiences like affecting one's self-worth, self-confidence. You have extreme situations where persons experience what we refer to as post-traumatic stress disorder, where persons may find themselves having difficulty sleeping, having nightmares, re-experiencing the event, even not being able to return to normal life functioning, like they just feel very exhausted and they cannot get the energy to continue with life as before. You have things like self-blame, feeling guilty. Those are some experiences psychologically. Persons also experience anxiety, depression, fear of future pregnancies, what that experience will be like, that whole crippling feeling. So yes, those are some things persons experience.
Okay, so many things from the psychological perspective that the woman can go through. Now, sometimes when we speak about that traumatic event, that miscarriage, sometimes we kind of separate women into those who have never had children and have miscarried, so they have no children, and those who maybe have children already and miscarry. And we sometimes think the experience is different. But I want your perspective. Is it really different from the psychological perspective if you have children already, or if you don't have children yet and you miscarry? How does the mind deal?
Okay, again, like with the psychological effects, we have to note that, well, we are varied human beings, so everybody's experience may be different. So we start with that basis. So you may have a woman who had children before, experience a miscarriage, and it is very traumatic for that individual. You may have some because they have children before, they are aware that they can successfully maintain a pregnancy, so it doesn't affect them as badly. So it depends on, each individual is different.
Okay.
And also, another thing that just came to mind, also the stage in life the experience happened. So you may have a woman, she may have children before, but let's say that's the first child with her husband. Because it is happening at that point, the desire, and how society looks at, having a child for your man or your husband, that may add additional pressure and, that sense of guilt and so on. So even if the woman has children before, because of, that situation, it may affect, the individual. So yes, it depends on different factors.
Yeah, that's a very interesting point that you brought up. The situation that the person is in, it makes the whole experience different, So in terms of a woman who has had a miscarriage, and we spoke about all the things that can occur psychologically, depression, the PTSD, self-blame, and that type of stuff, what kind of coping mechanisms would you recommend, or would you recommend that a woman who has undergone a miscarriage seek some sort of psychological intervention?
Okay. Again, it depends. If a woman has a very good social support, so their partner, either their boyfriend, husband, they have a good relationship, that might be sufficient to help the individual get over the miscarriage. If an individual doesn't have a good social network, it would be important for them to get psychological assistance. You may find persons with a good social network and for some reason they're just not coping well and they may need, that additional counseling and psychological help. Other things that I would suggest in terms of coping, it is important, the mindset, that persons understand that they are not alone. It is a common occurrence. Sharing the information with others, talking to persons, not necessarily counseling per se, but just talking about it. Talking is therapeutic. So it is important to talk with persons who experience that experience, and just with anybody who is willing to listen and support you. Stay away from the negative ones, because it is a taboo topic, persons can be, very negative and say the wrong things which are not helpful.
Right. So, ladies, they say we like to talk. It's Women's Health Plus. I'm talking to the ladies directly. They say we like to talk, but talking, Mrs. Yankee just said, is therapeutic. So if you're talking to the right person and you're sharing, your experience, then there's nothing wrong with that.
Nothing wrong with
us
that.
liking to talk. Okay, Dr. McIntyre, Dr. McIntyre, let me get back to you for a little bit. I want to know, after the occurrence of the miscarriage has occurred, medically, what is the recommendation for jumping back on that wagon and trying again? What is in place? What are the protocols for that?
You spoke to the right person. Psychologically, you have to be in the right state of mind.
Okay.
To actually want to do that.
Okay.
Whether or not you can, because if you go into it and something like that, because most people think that it's going to happen to me again. Okay, because one of the stuff that happen with miscarriage is that the increased risk is that if you had previously had a miscarriage, the chances are you can have a next miscarriage.
Okay.
Okay, so if that in mind is whether or not you're psychologically there.
Okay. So medically or physically, there's not much to
Depends
consider?
on what caused the miscarriage.
Okay.
It depends. If you just had a miscarriage that, let's say, genetical issues, by first trimester you had a miscarriage, you can go by the next period, you can go. As compared if you had a traumatic incident, like probably an accident, uterus was involved, getting damaged, you would have to take a longer period, 6 months to a year, to make sure that you heal properly.
Okay.
So it depends, but the most important thing is whether or not you're in a state of mind to actually go through with it. But from a medical point of view, if you want to go and try, you do investigate why it happened, what's my next step, and then we move forward. But state of mind is very important because the stress factor is also contributing to it as well. As all you say, talking is important.
Yes. And stress. I'm glad you brought that in at the end there. Another important consideration.
It's a real thing.
Yes.
It's a real thing. Depression is real. Yeah, I've seen it many times. And it contributes to a lot of things that kind of hinder us, day to day. So talking, as you said, support system. Whenever I interview a patient who have gone through, first thing I ask questions, do you need me to find somebody to speak to?
Right.
Do we need me to write a referral so you can speak to somebody? Do you have a support system at home? The social aspect of it is very important. If you don't want to speak to, let's say, a psychologist, speak to your church leader, a minister, a priest, or someone like that, because you're not alone and you might be surprised as to how many people are like that.
Okay.
Yes.
So that takes me nicely to the last aspect of the discussion that I want to have. Dr. McIntyre, you are the first male guest on the spill.
Wow.
So we need to talk about the men. People keep telling me, the spill, we need to have men on and we need to get things from the men's side. I want to ask Mrs. Yankee and I want to ask you too about the men. In this whole discussion, we've been talking about having a miscarriage and we've been talking about the woman, the medical concerns of the woman, the psychological concerns of the woman. Let's for a little bit talk about the man, the male partner. What can that traumatic event, having that miscarriage, what can it do to the partner, and how can the relationship between the partner and the woman kind of, I don't want to use the word suffer, but what can happen? What are some of the concerns with that relationship? And I want to hear from our first male guest as well. I mean, it's not from a medical perspective, but just, how would a man feel about something like that? Either one can go first.
Please go first.
Ladies first.
It is a ladies' show.
Yeah, so Mrs. Yankee, tell me what, from your experience, the relationship with the man, what can happen?
Okay. Again, it depends on the relationship that existed before the miscarriage experience. So if the relationship was solid, strong, it puts the couple in a better starting point to get over that hurdle. Okay. But you still find couples who are felt to be in a good place, it can rock their world. Because both parties may not be on the same wavelength, so they may be experiencing their grief and emotions differently, and that may lead to misunderstanding. So then the woman may feel that he's not grieving like I'm feeling, the grief and the loss, he doesn't care, and that may not be the case. It may just be that men go through their emotions and feelings differently, so they may not bawl and roll on the ground. They may use suppression to deal with their emotions and feelings, and then the woman wants to speak and, let's talk about it, let me hear what you're feeling. So then, if they are not opening the discussion, the misunderstandings, then the arguments, and then avoidance, because the man may not know, even if he loves his partner and wants to be there for her, he may not know how to show that to her. So then, he stays away, he's silent when, you might need the person to, speak up a bit. So you have all of those dynamics. Sometimes one person may be ready to move on before the other one. So maybe the man might feel, okay, 6 months has passed, let us try. Not wanting to be insensitive, and then the woman might feel, but why are you rushing me? So all of those dynamics come into play with the relationship.
Okay, I can see that. I can see particularly the time for trying again and the whole thing of, one person maybe being ready to go forward and the other person is still wanting to hold back. So I can see how that can cause definite conflict in a relationship. Dr. McIntyre, I mean, from experience with men and just what you know as a man, how can that miscarriage, that traumatic event, how can it impact?
Well, I'm going to take it from a perspective as a doctor, okay? Because whenever I break the news to the patient, female, the spouse is there, or the boyfriend is there. And I've seen mixed emotions, different, as she was saying, men process themselves different, okay? A lot of times you see the male just break down, some of them just break down. They are devastated. But everybody is more pushing towards the female. No, don't get me wrong. The female just went through the traumatic incident, but the male is going through a psychological issue as well. How do I process losing my child and still be there for my partner to give the support? Do I feel, up to it? Or where do I muster that energy to continue? And even if it's breaking me down, how do I do that? That's one incident. The next incident is the blame game. I told you not to do that. I told you this would happen. Because then again, how we process this thing. Because some males do not know how to just speak and not be that macho thing like blame you. But some of us, that's how we project, our energy. We do not know how to push it out. So it depends on the male. For me, I'm very much involved, I deal with that on a day-to-day basis. I have not been able to probably fathom losing a child. So therefore, I'm very concerned with how the female processes it. But also, I take time after I finish speaking to the female. I pull the husband or the boyfriend aside and have a conversation with him. Where do you stand? How do you feel? Do you fully understand what just happened? Do you guys have a good support system at home? Do you understand what just happened in the sense that it's not her fault that the situation happened? And these may be the reasons. But based on the timing as to when it happened, be it early in the pregnancy, I cannot tell you much. But let's say if it's later down in the pregnancy, second trimester, let's do a postmortem. Let us get more answers so you can feel better about the situation, to not blame each other. Because the dynamics of the relationship does change. It either makes them stronger or it breaks them, to be honest with you. I've seen relationships dismantle because you play a blame game because I cannot be there for you. How do I continue being a man? Now, when you strip away from a man, that's difficult for some men. Okay? Strength is there. Don't get me wrong, not everything is damaged. You get strength from it. And I've seen relationships get stronger. I've seen bonds, I've seen people get much more in tune with each other. They put aside all the differences they had before and they focus on getting better with each other. So it's not always the negative aspect of it, but you can see that there's some good from it. That we understand what just happened. And it didn't happen to you, it happened to me. It happened to us, one unit. Okay? So that I see. And the most important thing is the psychological part of it. They need to speak. Internalization, compromisation is not good. It breaks you down. Okay, you need to speak.
Okay. So I'm happy for that. I'm happy to hear, from our first male guest about that male perspective. I think that's so important.
I take that good, by the way. I'm the first male.
Yes, of course. A pioneer on the spill on Women's Health Plus. Our first male guest. Guys, it was very nice having you on the spill. I feel like our discussion, will definitely have some sort of impact on people who are listening. And I am very happy that you agreed to join me on this spill. I look forward to maybe seeing you again in the future. I was told we need to have a spill reunion at the end of a certain number of shows. So I might see you again on this spill. But thank you again, Mrs. Yankee, Dr. McIntyre. It was my pleasure to have you.
My pleasure as well.
My pleasure.
Thank you. Thank you for viewing episode 5 of The Spill. If you liked this episode, and I know you did, please share it so that your friends can get a chance to look at it too. Thank you so much to our guests who agreed to be on The Spill, and thank you so much to our sponsor, Nature's Discount Dominica, for supporting this show. Remember, follow, like, share Women's Health Plus.